Okay, hello. So what's up, dears? Ayan, so good day, no? Good afternoon ba? Or, yeah, whatever. So good day, ayan. So welcome yet again to another pre-recorded lecture in your clinical bacteriology class. Okay, and actually happy to tamahuman. Gamay-gamay na lang ng mga pre-recorded lectures, okay? And for this part, or for this lecture, what we're going to talk about now is your antimicrobial susceptibility testing. Okay, so we have already done now with, determining the different plating media, determining the different culture media na atong gamiton for culture. And then after that, of course, microscopic examination of our specimen using gram staining. No, then we have already identified mga gram-positive cocci, gram-negative bacilli, and all that. And then finally, you have biochem, of course, for identification of your organism. And then finally, of course, after identifying them, we then test the different antibiotics or the different drugs that may be used against them so that, of course, matabangan nato ang patient na maayos siya. Okay? So, basically, this is the last part of our job in the bacteriology class, in routine lab, or in the routine lab na section sa bacteriology. We first, again, identify, alright? We first isolate, okay, using the different methods of plating, streaking techniques, also, and then next na pod kay microscopic exam through gram staining, all right, and other stains, and then finally to identification using biochemical tests, all right, and maybe in some high-end laboratories molecular methods, and then finally we test the known antibiotics against these organisms so that we will help, okay, so that it will give the doctors an idea as to what are the possible treatment or possible agents that can be used against this particular pathogen that caused the infection or that is causing the infection in our patient. Okay, so I do hope na get siya ang murag flow nato sa or atong role sa bacteriology or in the microbiology section sa lab. Okay, all right. So again, this is antimicrobial susceptibility testing. All right. So first is we now talk about the assay. Okay, so again, AST, these are methods that we employ to provide and detect resistance to agents that may be used therapeutically. All right, so aside from knowing the different agents that can be used against our pathogen, we can also detect the different resistance, okay, that these pathogens may possess to these antibiotics. May it be innate na resistance, like naanagid sila daan-ana, or is it contributed by environmental factors, okay? So, because it's important na makabalot sa tambal, but we also want to prevent resistance, okay? Or we want to detect it as early as possible para maagapan dayon siya. Alright? If na resistance, then magpatakatag-hatag og tambal, then of course wala siya pulos. Kay dili mo work sa patient. And aside from that, pwede pang worsen ang condition sa patient. Okay? Alright. So testing is primarily implicated to, again, determine the extent of the organism's acquired resistance. So when you say acquired resistance, nakuha niya or naano siya daan-ana. Okay? Alright. For any clinically important organism whose AST is unpredictable, so especially if na mga organisms that are really prone to developing mga resistances when they are exposed to different agents, so it's important na we determine that. Kaya ang AST profile is unpredictable. Like what if one time kay susceptible siya ani na drug and then the next nimo pag-test nimo kay resistant na inana. So it's important that we determine that or we detect that trend, okay, or that mechanisms, all right? And last is provide the physicians, of course, the organism's susceptibility profile as another key component of the laboratory report. Again, ultimately we want that we provide the physician or the physicians important or pertinent information as to how we can treat the patient, all right, using these antimicrobial agents, all right? Okay, ayan. So, first, before we start with our assay, of course, we want to first standardize, okay? So, what is the importance of standardization? The standardization is important because it controls the impact of environmental factors. Now, it makes certain that standardize imuhang procedures tanan para makaingon jud ka na ang susceptibility na na-cause or ang zone of inhibition na produce or the susceptibility that the agent is causing to the organism, it's really caused by the agent mismo. Dili kay tungod kay na-expose sa different factors, dili kay daghan ra kay imuhang kagaw na gi-inoculate, dili kay gamay ra kay imuhang tambal na gibutang, okay? It's really because jud sa tambal na imong gibutang or regardless of the environmental factors. That's the importance of standardization. Okay? So muna siya, kailangan siya i-standardize before we start with any method of AST. Okay, ayan. So again, for standardization, it optimizes bacterial growth conditions so that the inhibition of growth, again, is not due to limitations of nutrient, mga environmental factors, or mga temperature. Because we want to make sure lang yun, we want to be certain na if naman gani inhibition of growth, it is really caused by the agent mismo and not by other external factors. Okay? Alright. Ayan. And again, optimizes conditions for maintaining antimicrobial integrity and activity. Okay? Alright. So that failure to inhibit, okay, so again, still the same reason. Kung again, dili po siya ma-inhibit, we could also say, since standardized man ato ang procedures, we can also say na it's due to the innate resistance of the organism. Not again due to environmental factors, not due to external factors. Okay? Alright. Or environmental drug inactivation. Okay. And last, it maintains reproducibility and consistency of results so that the same organism will produce the same resistance profile or susceptibility profile. So, because again, you're confident enough na magod na standardize siya, since standardize imuhang pag-test, so makaingon jud ka na bahalag unsa na kakinsay mo perform ani bahalag asa na lab kay since standardized man ang test, then you will expect na ang organism, kaninong organism will produce the same results when it is subjected to this particular antibiotic ba or like that. Okay? So I do hope na gets lang. So muna siya important sa imuhang standardization. Di ba sa inyong research, it's really important to standardize para ma-reproduce siya and makaingon ka na your results are not really that affected by environmental or external factors. Okay? Alright, ayan. Okay. Okay, so since we're talking about standardization, now what are the different factors or the different components that are standardized? So first, we will standardize the bacterial inoculum size. So when you say bacterial inoculum, is of course how much bacteria bang atong introduce ato ang media. Next, you have growth medium. Unsa atong gamito na medium, di ba? As mentioned pa sa culture media preparation, the medium of choice jud for AST is the Mueller-Hinton agar, which is your base. Alright? And the growth medium pag yun, iyang characteristics na dapat nato i-standardize. You have pH, cation concentration, blood, and serum supplements, thymidine content, incubation, thymidine content. And then, of course, in terms of incubation, the atmosphere, temperature, and duration, like how many days nato siya incubate, at what temperature, at what atmospheric condition. And lastly is the antimicrobial concentrations or the concentrations of the drugs na atong i-test. Okay? Alright. Ayan. So, now we go to the methods that directly measure your antimicrobial activity. So, these involve bringing, atong i-bring together ang imuhang antimicrobial agent against sa kagaw na ato ang gistadihan. Alright? So, atong parang ipag-away sila. Or like, ato sila i-face-to-face, yes naman. Para at least, makabalod siya dayon, if nabadyo yung activity, ang imuhang antimicrobial against this particular organism. Alright? In the in vitro environment. So, in vitro, outside of the human body, in the laboratory setting. Okay? Alright. Ayan. So, direct measures of antimicrobial activity, we have different methods. Number one is conventional. So, when you say conventional, traditional, so these are the methods that are still being performed until now. So, mga disc diffusion, broth dilution, and agar dilution. Next, you have what we call commercial susceptibility testing systems. So, mga automated na. Alright? And some of the routine labs, if not most pod, are using mga automation na pod in susceptibility testing. Alright? And last is special screens and indicator tests. So these are usually tests that are specific or special mostly for detection of resistance na yun, like resistance of an organism to beta-lactam drugs to determine if na ba siya resistance to chloramphenicol, mga ganun. Okay, so kanina mga special tests. Okay, alright. Ayan, so we now go to the general consideration. So first is of course, diba, for standardization, we have to standardize first is your inoculum, right? So for the inoculum preparation, we have two important requirements. First is, of course, the use of the appropriate culture medium and, the use of a pure culture. And as of course, next is the standardized inoculum. All right. So for that, we have to make sure that, again, your culture is pure. Because again, walay pulos if, example, you have a culture media, no? And then, or you have an isolate. Then mo siyang gi-culture. So, let's say wala nimo siya gi-check if pure culture ba siya or dili. So, let's say ma-appeal nimo ang duha ka species of kagaw na naa dito sa imong plate. So what will happen is, ang iyahang results sa pag-AST nimo, you cannot say na it's really definite na kani kay for E. coli example or kani for Enterobacter example. Because again, mixed sila. So you don't know kung katong na drug, asa ba siya ni-effect sa E. coli ba or sa Enterobacter, di ba? So we have to make sure that again, it's a pure culture. Alright? So for the first step, we have to select 4 to 5 colonies. Alright? So we want to make sure na 4 to 5 colonies siya para daghan. Dili ra kay malimit po ang ato ang pag-select daw o mga colonies na ni-mutate na, alright? Because of incubation and all that. Alright, so 4 to 5 colonies of the same morphology. So imong lang tawon gyud na same sila morphology. Alright? Na pareha sila na small colonies, pareha sila og color, pareha sila moist ba, pareha ba silang dry, inana. Okay? Alright. And then next, we inoculate into a broth. Okay? Okay? Pwede na TSB, usually TSB, trypticase soy broth. And then incubate at 35 to 37 for 3 to 5 hours, mid-logarithmic until turbidity is observable. Now, this is one method. Okay? So, sa imuhang plate, right, na naka-isolate, bukuha ka 4 to 5 colonies. Okay? Submerge it in your broth and then incubate for 3 to 5 hours, mid-logarithmic growth. Diba? Recall your imuhang bacterial curve. You have the lag, the log, you have the plateau, and then the decline. Okay? So, lag, right? So wala pa na sila nag-prepare pag nutrients ang mga kagaw, right? And then sa log, kay dito na sila nagkadaghan, okay, nag-increase in size. And then plateau, okay, all right? So number of number of alive is equal to number of deaths na sa imuhang kagaw, all right? And lastly is the period of decline. So mas nagkadaghan na ang namatay. Alright. So if pangutanan mo unsa na phase sa imuhang bacterial growth, kanang pwede mag-test for AST dapat sa log. Okay? Because again, they are actively replicating. Alive pa kayo ang kagaw, no? Fresh pa sila, no? Alive na alive. Okay? Alright. So muna siyang dapat nasa mid-logarithmic. So sa tunga-tunga. Alright? Okay. Ayan. So that's one method. You get 4 to 5 colonies from your plate using a swab usually or pwede loop, and then immerse in a broth, then incubate in your incubator for 3 to 5 hours, and then look for turbidity. Or another method is we compare it with a standard na inoculum. Okay? So example, select 4 to 5 colonies from your plate, okay, nag-incubate, and then ato na siyang i-suspend in a broth or saline until the suspension is turbid. Okay? And this turbidity, we compare it to a prepared already standard inoculum. Alright? Or prepared standard na ito i-compare ang turbidity. Okay? Alright. And this is known as your 0.5 McFarland standard. Okay? So, kani siya guys, dili ni siya, kaning McFarland, it's not made from a broth. It's not made from bacteria. Your McFarland is made from 99.5 ml of 1% sulfuric acid and 0.5 ml of 1.175% of barium chloride. Because if imo na siyang i-combine, they form a precipitate known as barium sulfate. And this precipitate results to a turbid solution. Okay? And kanina turbidity na solution, okay, muna siya itong i-compare sa ato ang broth na nagama. Okay? Now, if same slag turbidity, then that would mean that the turbidity na nasa imong broth na gigama is equivalent to about 1.5 times 10 to the 8 CFU per ml. Okay? So meaning, there are about 1.5 times 10 to the 8 na mga colony-forming units or mga bacteria na naa sa imuhang per ml na nasa imuhang broth. And muna siya itong standard na gamiton for our inoculum sa ato ang AST. Okay? Alright. So again, turbidity can be matched using, if lataw na gyud nato, ato i-compare. So example, you have 1 tube for McFarland and 1 tube for your broth. So example, kani ang McFarland. Okay? And then muna imong broth na naay pathogen nimo. Okay? So ato i-compare ang turbidity nilang duha. Alright? So kung unsa ka turbid ang McFarland, dapat mo po diyang appearance sa imuhang broth. Okay? Para makaingon ka na kanimuhang broth, okay, contains about already 1.5 times 10 to the 8 CFU per ml. And that is the prescribed number of bacterial suspension na kailangan. Okay? Alright, para sa imong AST. So, pwede ito na siyang i-compare sa gamit ratong mata, ato ni siyang i-place against a background na ay black lines. Okay? Or pwede mo gamit taog spectrophotometry or optical density to measure turbidity. Okay? Ayan. So here's an example. Ayan. So we match it using, again, a black line, a white background and a black line. Alright? So muna mong McFarland and then muna mo hang broth. Okay? So imong lang tawon if dapat same na sila og turbidity. Alright? Ang appearance nila. Alright. And then, last, you have tabletop spectrophotometer. As you can see sa picture, di ba? I don't know if klaro kay medyo na buang-buang ang projector, but sa inyo ang handout, if kabantay mo, di ba, kani siya is medyo baga kaysa, mas turbid siya compared sa yung McFarland. So how do we resolve that? Okay? So we resolve that. Okay. We adjust the suspension if the turbidities are not equal. So if the suspension is too heavy, okay, or it's too light, it's like lighter siya, mas less turbid kaysa sa McFarland, we add more colonies, okay? Depending na na siya sa inyong procedure sa lab or sa SOP sa lab. Alright? So again, if too light try mo hang suspension na nagama compared sa McFarland, you get more colonies and dissolve it sa broth. Whereas if it's too heavy, mas turbid imong suspension na nagama. Kaysa sa McFarland, you add saline or broth. Okay? So, mura na siya. Adjust the turbidity until exact na gid silang appearance. Okay? So, ako personally, mas try yun na mag-compare ka sa using optical density or spectro. Kay mas accurate man kaysa sa imong eyes. Kay it's much more subjective using your eyes. But in the routine lab, if wala kay mga optical density machines and all that to compare, then we opt usually for the eyes na lang. Or we compare it with our eyes. Okay? Alright. Ayan. And use prepared suspension dapat within 15 minutes of preparation or within 60 minutes. So, 15 minutes to 60 minutes dapat magamit na nato siya. Alright? Kaya if more than that, pwedeng dili na mo work kayo mo hang kagaw or namatay na sila or wala na gyud. Dili na kayo mo perform well. Okay? Alright. Ayan. Okay, next, we now go to the selection of antimicrobial agents for testing. So, unsa man ang mga antibiotics atong gamiton? So, these are the different criteria. Number one is organism identification group. Now, we exclude your antimicrobials to an organism that is already, we exclude antimicrobials that are already known that the organism is resistant to, intrinsically resistant, meaning naanagid sila resistance daan pa lang. Alright, so example, vancomycin versus gram-neg bacilli. Diba? Recall sa ato ang gram stain, we use vancomycin to determine kind of mga gram stain results na questionable because vancomycin is really, gram-positive organisms are susceptible to vancomycin, whereas your gram-neg are resistant. So, muna siya ang one of the rule. Resistant na gyud ang gram-neg bacilli nimo against vancomycin. So, we don't include vancomycin sa to ang testing for gram-neg bacilli. Kaya wala na pulos, right? Kaya resistant na good siya. And exclusion of antimicrobials that are not specifically developed for an organism. So, example, ceftazidime versus P. aeruginosa and not S. aureus. So, ceftazidime is usually used for your gram-positive organisms, so S. aureus. So we don't use it for Pseudomonas. All right? And next, acquired resistance patterns common to local microbial flora. So we include potent drugs if resistant to less potent drugs is common. Okay. So of course, if there are some less potent drugs na dili kaayo common ang resistance, then we include that. Okay? All right. Okay. If na ay less potent drugs di ay na most of your organisms exhibit resistance to the eye. So we include more potent drugs kaysa atong drugs na gyud. Kay since your organisms already develop those resistance against those drugs, and exclusion of potent drugs if susceptibility to less potent drugs is prevalent. So example, you have two antibiotics. Let's say you have penicillin and you have erythromycin. Now let's say your erythromycin is less potent, then penicillin is more potent. But if your erythromycin, which is less potent, is already kanang makapatay na siya sa kagaw, then we don't include any more penicillin. Whereas, if ang erythromycin mo na less potent, another scenario, if ang erythromycin mo na less potent, kay dili gyud siya inanaka-effective ang kagaw, alright, then we include a much more potent drug, which is in this case penicillin. Okay, so inana siya, alright, for selection. Okay, next one. We have antimicrobial susceptibility testing method used, exclusion of some agents that do not reliably detect resistance depending on the testing method. Because there are some methods such as a disk diffusion ba, or sa imuhang agar dilution, na dili ta makadetect sa resistance. Okay? So we exclude those agents na dili nato ma-detect. Okay? So if some other methods, then if ma-detect ang resistance, then we use that. Okay? Alright. Okay. And site of infection, of course, exclusion of antimicrobials that only achieve effective levels in certain body sites. So example, nitrofurantoin na effective ra gyud siya if gamiton siya for UTI or mga urinary tract infections. Okay? Alright. And next, wala pa din. Okay. And last is availability of antimicrobial agents in formulary. Because again, we don't want na magpasagad ta og hatag or mabutang og agent nya di ay to dili siya available sa atong pharmacy or sa test batteries ba or sa atong manufacturers, di ba? So walay pulos if mag-add kuno ta og antibiotic nya di ay to dili siya available. All right? So muna siya ato ang antimicrobial selection for antimicrobials for testing. Okay? And for the next video, we'll now start with the first type of your conventional testing method, which is your disk diffusion method. Okay?